urgency to like get them down, get them on the board. So we waited 2 years.
Do you have them already?
You're here.
Yeah.
And so this meeting.
You guys going up to the
Team.
Okay.
Is it recording?
Yes. We're recording.
Did it stream anything at all?
It just didn't work on YouTube. We're streaming on Waza, but we're recording it on our computer.
Okay, so no one in the community saw anything?
No.
Okay. All right.
Yeah, just start over and we're good to go.
Okay. We have to revote. So should we revote? But since we already voted.
Just report that we voted.
Okay, so sorry for the delay. If you're just tuning in from the community, we had some technical difficulties. We did start the meeting and we approved a consent item, which is a guidebook settlement package. And we were just moving on to discuss the early learning curriculum recommendation. And then we were told that the live stream wasn't working. And so we took a break until we were told it was working again. So we will go back in and if you could just start over.
Yes.
Which I know you had just introduced it, but if you could just start with your introduction again, that would be great.
I can do that. So the report that we're sharing tonight for discussion is an early learning curriculum recommendation. We're excited to have Liz Dunn, our early learning literacy coach, and Leah Bird, our early learning administrator, here with us in order to answer questions. Our recommendation is for a creative curriculum, and the report highlights the design process that occurred in order to come to that recommendation. So we welcome questions and feedback. Did you want to?
I had a question about milestones, and I think I was using different terms, and so Jody and I have conferred here, so I think my question's been answered. I have another question. I have to confess, I know the least probably about early childhood, and so this might be a basic question, but I'm sure others in the public might want to too. We're easily integrating with the pyramid model. Could that be explained to me what the pyramid model is?
Yeah, do you want to speak? Good evening. The pyramid model is the framework that we adopted 4 years ago. It's a 5-year grant that we had applied for and are in year 4 of year 5. And the pyramid model is really a framework that we use to help build kids' social and emotional skills as learners. And it helps kids, it helps kids sort of advocate for their needs, what they want, their concerns, articulate if they want to play. And pyramid is really how we teach our staff, and then therefore how our staff interact with kiddos on how you sort of work through social, emotional relationships and exchanges. For those of you that have been in the Early Learning Center, we have 3 simple rules: be kind, be safe, and solve problems. And if you think about it, those rules actually work for most people too, right? And so we really talk and spend a lot of time talking with kids about, you know, if you're upset about something, how do you articulate that? What can you do to problem solve? How can you help get through whatever issue it is that you're getting through? The framework has a really well-structured implementation process. All of the teachers go through some pretty detailed and lengthy training. And so they, as the whole school, every person in the building is expected to be trained. And so they go through different levels of training. And then once everybody has gone through that training, then they're assigned a coach. And that coach's role is to really check in with them on a regular basis, weekly, or maybe every other week, and just sort of help them work through what's working in your room, what's not working, how can we make changes, where do you need support from the larger school team if you have a kiddo who's struggling or a staff member who's struggling. And we've really learned down in the Early Learning Center that pyramid model of implementation of a new process and sort of mindset of how we work with kiddos has really worked wonders with our staff. It's been phenomenal, really, how amazing pyramid has worked for not just the early learning staff, but then the evidence is in the kiddos that we serve. And so we want to use sort of that same model of pretty intensive training and professional development, followed by some deep coaching and regular coaching with our literacy implementation, so that we can make sure that our teachers are really feeling supported and implementing with fidelity as well. The added on caveat, and I know you didn't ask this question, but I'll just answer it, is that we have used targeted service gold for many years as our assessment, and that's a pretty standard assessment early childhood programs use. Creative curriculum is the curriculum that goes with TSG. And so that's really exciting if you think about a teacher who has used an assessment for a number of years and really found an ability to have fidelity with that, and now to have the curriculum really complement that. So we feel really strongly that this implementation is going to go pretty easily for our staff because they already have that assessment piece under their belt, and they sort of have that mindset of how we implement a curriculum through the pyramid work that they've all been doing for 4 years.
Okay, so in my terminology, it's a structured way to socialize kids to how to behave in a school context, integrating their own emotions
Yep.
into the classroom experience.
Yep. How do we problem solve? How do we make friends?
That's what I remember from my years with ECFE.
Yeah,
Mhm.
right?
Our
Just
kids-
sort of that idea of how do we support kids becoming good human beings, right?
Being a friend and learning how to do school.
Being a friend. right?
Yep.
Feels like you could come down and teach for me.
I think I like it, actually.
Yeah. You're welcome.
So, okay, good. I was going to ask you about gold too. So I think I'll hold off. I had some other questions, but I'll just give the floor.
Anyone else can go?
I'll go. Yes, that was actually one of my questions was along that same line about implementation. So do you guys anticipate any challenges with this in the implementation? Do you have enough resources to make it for professional development, the short term and longevity? So that's my question.
Do you want to talk about the professional development plan?
Sure. We have a plan laid out, and this coming spring, we'll be doing the initial onboarding training. We have spoken with the publisher. There are 5 different sets of explicit training that we will be doing with their support. And then that leads into embedded training that will continue on within the PD structure we already have in place at the ELC. So the initial 2 for sure will be done this spring prior to anyone getting the materials in their hands. And then we will do this coming fall, like a fall workshop, when we have access to all the staff in one place again. That will be our next 2 intensive trainings. And then the 5th one will be spaced out over the following year. We're also rolling that into, as a literacy coach, I'm doing one-on-one coaching as well. And I'm using the pyramid framework for that. So that is starting actually now, next week. So we'll be that support will be in place with these larger whole group trainings as well. Did I forget anything?
No, I think I'll just share that, like every other teacher in the district, the early learning centers do professional learning communities. And so all of this is all connected, right? Everything is always connected. And so Liz and I also tag team in those PLCs just to make sure that we're helping facilitate that work. We're checking in with teams, really providing the support when they need it, not just with the one-on-one, but maybe even within their large group as like what we call grade level teams.
Great. And then I have one other, that's helpful, by the way. And you were talking about pyramid. I have gone down and heard the presentation on pyramid, and I know the results the growth is unbelievable with the students down there. So that's a great model to use for implementing this. So that's awesome. My other question is, so with this curriculum, the partnership with our kindergarten teachers are certainly in the district. Like, can you guys talk a little bit about that and kind of that bridge between what's rolling out here and what that looks like?
Yeah.
We have a couple conversations going on about that right now. And from the comprehensive literacy plan, one of the things that we are tasked with as literacy coaches is working on that bridging between the elementary building and the ELC. So we're starting with assessment, and we've met for the first time working on the assessment that we have in place at the ELC, the goal, and looking for alignment with the assessments that are in place for the incoming kindergartners. Looking for overlap, looking for places that we can work toward a shared goal. If there's a discrepancy or there's a gap in any of those assessments, we're starting there. I think it's going to be, it's an ongoing process, and it will not be something that we'll meet once or twice and we'll have it figured out. This will continue. It's really actually the strength of it at this point is just getting the communication open and getting those conversations going between the staffs.
And I'll just speak a little bit to, years ago, we had a kindergarten and pre-K collaborative group that met regularly every 6 weeks. Last year was just a stop year, let's all survive. And this year we picked it back up. I've surveyed the kindergarten team and said, how do you feel about this? And it's, it's really heartwarming because they've all said, yes, we want to have those conversations and we want to talk about what your kids are doing in 4-year-old programming and what we're doing in kindergarten. And really, if you think about kindergarten readiness, it's on us to be ready for them, right? And so how are we as the different groups of professionals making sure that we're providing the best learning in 4-year-old programming so there's a successful transition into kindergarten, and how is our kindergarten team knowing what we're doing in 4-year-old programming to help kiddos be ready to come into kindergarten and help our kindergarten teachers be ready to welcome them in. That also, the intention is for that to grow out within the community preschools as well. That's a partnership that we always want to have our hand in as the district. There's that little piece that there are competitors, but really we're all serving the same kids. So we want to make sure that we're having the same conversations about what does readiness look like for Edina Public Schools kindergarten as well. And then I'm just going to share that the Department of Ed is starting that work as well in terms of how are we making sure that the assessments that most of us in early learning are doing are aligned to the assessments that many of us are doing in the kindergarten world as well.
And that's referenced in the report. They're called CAP-approved assessments. And that was our starting point for all this work. We worked backward from there.
Can I just interject? That was actually my question was, does this curriculum and the objectives of this curriculum then basically build into the curriculum that we're using in elementary school, even so far as using similar terminology and things like that? So we're literally, it's a ladder that we're building our students up, and it's, that's basically
It absolutely does. That's how we found our way there.
Yeah.
That was step one.
And it also helps make the case for the partnership that Liz has with the district literacy coaches, right? Because that's a conversation we always want to be having. And the partnership that we have with the kindergarten teachers about, okay, yeah, concepts about print. What does that mean about concepts about print? Shared writing or shared reading or any of those emergent literacy things, because that's a really important point, that we want to make sure that kiddos are hearing the same language as they're going through the larger system on their skills.
And then really fast, I just have a comment from Ellen. It says that it sounds like the development of this curriculum was handled with great intention and a comprehensive process down to last detail. I have no questions or concerns improving this curriculum. So I just wanted to make sure that she got her comment in.
Yeah, I don't have any more questions. That was great. Thank you, guys.
I had a lot of questions answered in teaching and learning, so this is my second time doing it, so thank you. I do want to, as Ellen said, acknowledge that the process that you took to get here, I'm very grateful for, and the team members within our district that you reached out to for input. I'm very grateful to see that comprehensive plan, the comprehensive approach that you took. I'm proud of that within our district and your work, so thank you. My only question was, and I'm trying to remember where I read it, there was comments about there being a link to, I don't know if there are tools that families can use, or can you talk a little bit about what that will look like? I think is it taggable, or is that a piece of it, kind of like Seesaw, but will there be tools families can then learn?
There are 4 components of the materials, and one of the 4 is parent engagement materials. So it's all family-facing resources. We actually have meetings in the district right now going on with several different, there's a lot of energy and excitement over family literacy in the district. So I'm hearing from all sorts of folks that want to help with that work, and we are getting a feel for where that's going to go. The resources with the curriculum are extensive.
Okay.
So it's a little bit of, if everything's important, nothing's important.
Right.
So we're picking a starting point with those. We'll start with some family literacy nights, what those look like. We're going to use their resources, but what those look like and how they're implemented, we're still working through all that.
Okay. Well, I appreciate that piece of it. Thank you.
So does that translate into encouraging the parents or caretakers to read, say, half an hour to the children every day? Because that's often cited as a very useful skill, very useful practice for helping kids to develop early literacy.
And reading and extending ways to read with them.
Mm-hmm.
So some learning in what does that look like to read with your son or daughter? What could it look like? So those are all built into the materials that come with this one.
Okay, that'd be great. And I don't know if this is sort of alluded to, but previous questions or not, but so we have other pre-K preschools in Edina feeding in, and some just on the border outside of Edina, feeding into our kindergarten schools classes. Do we have any liaison programs with them? I guess we used to do something like that. Do we do anything like that just so that we're on the same page with them?
Yep, so we used to do something like that, and COVID sort of put a hold on a lot of partnerships, but it actually is a goal to have a partner with our local preschools. Creative curriculum in TSG is widely used in school districts, and I don't know off the top of my head if the other preschool programs use them, but I can speak to Berry Patch as one of our local preschools. I'm good friends with Molly, who is the director of that. And so we have regular conversations about, what are you guys doing to get kids ready? What curriculum are you using? There is really, I think, a thirst for more of a partnership. And I wonder if through family literacy, that's really an opportunity to build that partnership. And really, if you think about it, even through our ECFE program and our parenting education, that's another great way to build partners with other preschools around the area who might not have the same parent education that we do, but we can then partner with those programs to say, this is the parenting ed, this is the family literacy, here is the creative curriculum that we're using in our school.
I'd be really excited to see a lot of that outreach.
Yes.
So, in terms of the cost of what you outlined, is that already in your budget somewhere?
It's in the teaching, it is in the teaching and learning budget, yes.
Okay, so you're not needing extra funding?
No, it's with our current funding resources.
Okay, thank you.
And from a process perspective, are you looking to approve this in December or have it come for discussion at December board meeting?
We'd like to have it approved in December. Do you want to talk about the benefit?
Yeah, I certainly can. The price of the curriculum does go up in January.
Okay.
10%, I think, is what you said. And so if we, yes, could have it, at action in the December meeting, and that would help budget-wise.
Okay.
It's another about $7,000.
Yeah.
For the same material.
Okay. All right. Thank you. Anything else? Nope.
No.
All right. Thank you, guys.
Thank you.
Thank you.
Thank you.
Okay. Next up for discussion, I believe is Dr. Stanley and Assistant Superintendent Snozzle for our COVID update.
Actually, it is Director Jorgensen
Oh, sorry.
and Health Services Coordinator Mary Hyman.
I apologize. Are you sure you don't want to come up, Randy?
I
Give him a chair.
Yeah, that's good.
Just reading the latest news on Aaron Rodgers.
That's a COVID update.
It is a COVID update right there, yeah.
It was apropos and we didn't know.
There we go.
All right, well, we are here to provide COVID-19 updates. We, in our return to school plan, we had stated that we would provide ongoing updates to the community, and we have so many great things that have been added to our mitigation efforts. And so tonight, we're going to provide an update where we're at locally, the context around case rates, and then Jeff and Mary are going to provide you an update on our testing efforts and on our recent vaccination clinic efforts. So just to start, many probably have heard that Minnesota is a state that has high COVID transmission rates right now. Hennepin County, the case per 100,000 is about 382 cases, or 9.89% transmission rate. And then if we move into Edina, we're in the high level as well. We are at 201 cases per 100,000. So we still remain at that high level. And the way the levels go, remember we discussed this, they go from low all the way to high being the highest level. If we then move and we talk about our school district COVID positivity rates, this data was last updated last Friday. It's on the COVID dashboard. I trust that the community is aware where to find it now. But for the week ending in November 12th, the total was 29 positive cases. That's the week ending November 12th. We are excited because our 9th through 12th grade vaccination rates went up. For the longest time, fully vaccinated rates hovered at 77%, and we went up to 80.54%. So it's nearly 81% of our students at the high school, 9th through 12th grade, are fully vaccinated. Same thing, for a long time, 6th through 8th grade, we hovered around 50%. And again, it's important to note that this is fully vaccinated as of November 1st. So the updates that you're going to receive from Jeff and Mary do not include the students who received their first vaccinations at our vaccination clinics last week. But 6th through 8th grade, we're at 72.32% fully vaccinated as of November 1st. So that provides a context for the conversation and information that was provided within the report that Jeff and Mary are here to discuss.
All right. Well, first of all, we're going to start off with just an amazing event that took place during November 9th and then November 11th, where we coordinated with some providers within our community to host a vaccination site here both at Valley View Middle School and at Southview Middle School. We also did a drive-through clinic at Concord Elementary School for students that had difficulties accessing the walk-in clinic. And when all is said and done, we vaccinated 1,491 students. An amazing endeavor for such a short period of time. I was over at the Southview site. I know Dr. Stanley was over there for a short period of time as well. She just walked in and said, wow. And it was wow, because we had the line wrapping all the way through the first level. And I mean, it wrapped back on itself all the way through Southview. But it was an amazing thing. People waited about an hour on average to get their vaccinations for their students. Our team, our healthcare providers, showed up en masse to help out with drawing up the vaccinations. And so Mary and a group of our LSNs and HSAs were there drawing up each of those shots. But after an hour's worth of time, parents were getting out and getting their children vaccinated. It was a fun event. I was walking down the halls and just making sure that everyone was comfortable, apologizing for the wait. The most common phrase that I heard back was, we have waited a very long time to get access to a shot for our students. And so waiting an hour is nothing. And so they were very happy to wait for that hour to get there. And there were sure some hungry kids, but by the time things were done, but we didn't have too many screaming students as we thought we might have. There's a few, but for the most part, it went very, very well, and it ran very smoothly. People were the conduct was great, the flow was great, we were able to get students in and out, and they came out with their vaccination cards. And I have one other anecdote that I wanted to share, which is one family showed up right at about 6:30, and they took a look at the line, and mom looked at her daughter and said, "Are you sure you want to do this?" And the daughter's kind of hemming and hawing just a little bit, and then a friend walked in the door and so said, "Yes, I want to stay." And so the kids were excited about getting the shots. It was not just the parents that were anxious about getting it. It was also the kids. And so it was a really great feeling. I get a lot of thank yous that night from parents saying that they were so pleased that we partnered with the community providers to do this and host this event. And so we're very pleased with everything that took place.
I think the skill and the dedication of the vaccinators and everyone who helped us was just significant as well. I think that really made things go very well. And it was, and there was just a lot of extra support needed at the Concord Drive-Up Clinic. So that was just a really, it was a fantastic resource for families as well.
So Mary, you said you had some results for us in terms of a poll, in terms of how many students were vaccinated out of our own community?
Yeah, Bloomington Public Health did a, 30% of the 5 to 11 year olds by zip code in Edina are now vaccinated. Partially vaccinated.
30%?
They're the first dose. 30%. Yeah, 30%. Yep. So that is very impressive, was the quote that we got on that one. So very, yeah, huge. The only thing, Dr. Stanley, I just want to update you. So we actually did a report as of Friday on the vaccination rates. So 9 to 12, grades 9 to 12, it's 81.21. So that actually went up, just ever so slightly. In the 6th to 8th grades, it's 70.82. And the reason that went down is just because now we've added 1,200 more students to that pool that are only on their first vaccination. So we'll have to do, another look at that report after December, the December clinics. So that, we just have to take it for what it's worth at this moment in time. So that's what that's all. So we will get that updated on the dashboard, probably with a little bit of an explanation of why that number decreased.
Great. All right, so we had such success with the vaccination clinic. I know we had board members and board members elect that were there during the day that were helping to support, appreciated that. And as you said, it was a true community effort. There were students during the day who were vaccinated, who were at the school, so that's why that was available. And as I was standing there in the line, the camaraderie, so there were students who were still nervous. They may be in middle school, but they are still nervous about getting a shot, right? And to hear their peers behind them saying, "It's okay, you're going to do this, you have this." I mean, it was really moving. It was incredibly moving. And so just incredibly proud of the entire community that turned out to support our kids. So then we're going to move into an update on where we're at with testing now.
So we just wanted to give you an update on where we're at with our symptomatic testing protocols, because we were running into some bumps early on with the symptomatic testing, which was really largely just about when we have a student that is symptomatic, whether they're at school and we identify them as symptomatic and they're going home, or whether they're at home and are identifying as symptomatic and not being able to come into school. Our testing protocol was really identifying that we wanted to get tests in the hands of families and make sure that they have the test available so that they could do that symptomatic testing within the home. That Binex now over the counter is our test of choice that we did get. Now they've all been delivered now, Mary, except for Southview. But we have been trying to work in getting those test kits distributed, so it isn't just, Southview just has to sit and wait. But we've been getting those out to families on a much more regular basis. I think there was some initial misunderstanding in the beginning because some sites had not received their full complement. And so they were being really kind of a little bit stingy with the tests and not making sure that everybody had one. But now we are walking through the test protocol. And so if people are identifying that their students are symptomatic, or if a student is symptomatic on site and we're sending home, we're making sure that the family has access to that Binax-Now kit. So we're also using them to some extent as well with some staff members. Is that correct, Mary?
Yes, yeah. Just because right now we have the supply, so we might as well get them to staff and families that, can use them.
And initially, we thought that wasn't going to be an allowable service that we'd be able to provide to some of our staff that might be feeling ill and going home during the course of the day. But that is something that we did check with the Department of Education, and that was okay as an appropriate use for that test as well. So once again, we are, as we take a look at the implementation of the symptomatic testing protocol, we feel like we're there. We've successfely started utilizing those tests and getting them out in the hands of families. And I think in here we also talked about that in many cases we're sending home enough kits so where anybody that's in the household can be tested as well. So it's not just about the symptomatic student. It could be other members that are symptomatic within the household as well, which I think helps us in helping us in our mitigation efforts. So the symptomatic testing efforts, again, I think are a solid success, and we're being able to deliver on the symptomatic testing protocol. On the asymptomatic testing overview, the testing protocol that we've had with the asymptomatic testing as we've talked about at quite some length at these board discussions, has been really contained. We've talked about the asymptomatic testing protocol as we have our symptomatic and COVID positive students. Then we do our contact tracing, and we get out to students that we know are needing to be quarantined because they're close contacts and because they meet some of the criteria they need to be quarantined. Then we have our third bubble out, which is the bubble that we really identified in our asymptomatic testing protocol, which is those students that are close contacts, but are not required to quarantine. That may be because they're vaccinated or because they weren't within that proximal level, or we could establish that they might have been both masked, they might have been not within 15 feet or 6 feet of each other, 15 feet. I don't know where that's come from. This is 6 feet of each other for 15 minutes of time. But we have started now to take a look at those student populations, and we've started to do some of that testing now. And it was a lot of organizational types of things that we had to figure out, but we have now been able to pilot this at a number of different sites. And I'm going to let Mary talk just a little bit about where we've done some of that testing from start to finish and what the results are.
So in the narrative, everything that I'm going to review is in the narrative. I think with the exception of on Friday, we did do some more testing. So just as an overall, so far we've done 19 staff members and 32 students. And all have come back. I was telling Jeff that in this report that we have to send to MDH, the language is not negative. It's not negative for COVID. It's that it's not detected. We've not detected any COVID virus in our lab results or in the Q test. So 19 staff, 32 students. With the thing that is quite interesting, frustrating with this is we've had seven failed tests, and so that's the little code that comes back on the reader is not detected. It's not valid, and so that's one of the issues of you go through all the way through this 25-minute process, and then it gets to the end and it says test canceled. You're like, oh, the student is gone, the staff member is gone. And we're trying to do some system workarounds where can we put the cartridge back in, but that's just the reality of this very sensitive little reader.
And so one little student, we called her back and we re-swabbed her and it was fine, but it's just, so I think Jeff and I figured that's like a 17.6% fail rate. So that's in what's called Base Camp. It's a Minnesota Department of Health kind of a listserv, and everybody talks about Q-tests. That's a very typical finding and frustration with this. It's good. The technology is there. It's a rapid molecular, but that's a pretty big issue with that. So next week we've got another clinic or another testing set up for 13 people. It'll be 7 students and 6 staff members. So we're kind of continuing to look at that, and that's 7 days after their exposure that they had in the classroom. So do you want me to jump into the next?
Sure. We were just talking about just the logistics of getting this done. This is that we've taken a hard look at this, and this is all contained in the narrative. So I'll just summarize it briefly. Is that there's a number of units that we can do with the Q testing, and it seems on the surface like it should be a fairly fast and effective model of service, but it does take 25 minutes per student per unit that we have. And so Mary actually had some pictures that I would love to have shared with you. It's just our lineup, the way we lay out the Q testing. We have all these units set up. They're little readers, and they have to heat up and so forth. And then you keep track of all your samples, and you stick those in. And from start to finish, in each batch that we do, it's about 25 minutes for that sample to go into the machine and then come back out. That's not counting the time that is there for the setup. That's not counting the time that is also there for the uploading of the information that's afterwards. So even in a smaller grouping of say 26 students, I think is what we had at one of our larger groups that we did. It took a considerable amount of time. So about half the day was gone by the time we got the canceled test students back in to get them tested again. And so it's about logistics. It's about trying to figure out how do we get this done in the best way possible. And so what we are considering in terms of how to make this more efficient going through the future, because we see this as a valuable measure. We see this as something that we want to continue to do. But instead of taking a look at disrupting the site to get that done, we're considering centralizing the testing, at least for our elementary buildings, at one site here, maybe at the districts, here at the ECC, and identifying a site to do that testing 3 days a week from say 2 o'clock in the afternoon until 5 o'clock in the afternoon, and making that an open clinic so that people can come in and get a PCR test done. So that could be in that first or that second ring or third ring that we talked about in terms of the post-contact, no quarantine. But we've also already started this. And so that targeted audience that we talked about, that targeted environment, really we've already expanded into that targeted environment. Because when we're doing 26 students, what we're saying is we're doing the classroom. And that classroom targeted type of focus is something that will really help us expand out our efforts to see whether or not there has been internal spread in terms of COVID, or whether or not we're able to catch those cases early. As Mary already reported, we haven't found a positive case yet, but our sample size isn't enormous yet either. But as COVID continues to spread in our community, I think Mr. Osterholm had said that right now Minnesota is one of the highest rates per capita in the nation right now. So there's an awful strain out there right now, and so we want to catch those cases when we can. So our recommendation in going forward would be we'd like to keep this going, but we'd like to do it in a way that can be a little bit more streamlined, where we're not having to do the setup takedown, where we'd actually have something set up and we wouldn't have to do all the tear down each and every time. It's just closing up the doors, locking them up, and being able to enter back in and being able to staff that on a regular basis so that it's not an interruption to the school day. Because right now with the interruption to the school day, it's taken away from classroom time, obviously, but it's also taken away from our healthcare providers' time to be able to do those other services that are taking place. So we're pulling healthcare providers from one site to another site. And we can staff this with volunteers. I mean, that's a way to do that, or we can contract for some of those services. But our contracted agents that we were looking into working with, there's a limited supply of those individuals as well. So we believe that if we went to a 2 to 5 time period, we could find a way to staff that, and we could find a way to work either with community volunteers or work with others that are willing to come in and provide that service with us under a contracted rate. We just think it's just more viable and sustainable to do something like that, and then we can offer additional services if necessary. If we decide to expand, that's some place that we can expand from.
And it would also allow us, so right now, for symptomatic students, we're using the Vinex now at home, and that's the rapid antigen. We could, if we get the designated space set up, we could use the Q testing, which is the rapid molecular, and we could have a symptomatic person come in and we could say, we'll swab you in the foyer area or, at the designated entrance. It'd be real safe. And so we could potentially look at that. So, it gives us more options. And the thing that we've realized about contracting with an outside agency, at least it's still at this point, it gets harder because it would be easier if we had something Tuesday, Wednesday, Thursday from, 2 to 5 p.m., just the set hours. So if somebody was symptomatic and, they wanted to come in and be tested, we could say, yes, there will be someone there. There would be a scheduled appointment time. And we could be more safe about that. So it just gives us more options as far as staff testing and things like that. So, and if it happens to be a staff member who's symptomatic, it would allow them to, if their symptoms are improved and they're negative, it would allow them to come back to work sooner without having to go to another testing site.
So we're really excited how testing has evolved. The last time that we provided the update, we were still waiting for the schools to be approved as lab sites, and now they've been approved. And I know that I have received email from parents who are grateful that they were able to test and then come back to school in a lesser amount of time of quarantine. And so ultimately our goal all year has been to have our students in school in person with the least amount of disruptions. And so appreciating the work that's happening around testing. So
can we have a broader discussion about our COVID response? And
Can I ask a testing
Yes.
question first before we go into other stuff? And this might be a Mary Whitey question. Is there a way that we could link the Binax Now instructions on the website, a place for parents to go to, and maybe put the video? I know that it's, once you've done it once, it's not that bad, but the first time you take that step out of the box, it's a little intimidating. And the video is very helpful. If there's a way we could link that for families to have an easy place to get that information, I think that would, especially if you've got little kids and everybody, it's just in one more place. Thank you.
Can I ask one? I just want to make a clarification. You guys have talked about the fail rate of the Q test, but that's a fail rate, not a false positive.
No.
Yeah.
Absolutely. Good clarification. It's absolutely a problem with the equipment, and no, it has nothing to do with that. I think it's just an internal issue that they have with the actual device. And like I said, it's a very common discussion point on all of the information that I read about Q testing. It's fantastic, but and it's an incredible resource for us. But I think that's just the reality of that. Because we go through multiple checks on, is it plugged in, or are all the pieces secure? And then you get this, oh geez, the cancel test says no, it's not that at all.
Okay. Yeah, I know it's a very reliable test. I just wanted to make sure, and
Correct.
the community listening and that
Yes.
board members understand that that's not
No.
the issue.
Mhm.
So, okay, that's great. And just a bit of feedback, I think having a site testing location, I think is a really smart use of resources. I would just encourage to make sure that any students who didn't have transportation to get here, that we make sure that everyone has the same amount of access. So that's it. Testing.
Is there anything else from you, Stacy, or your team?
One of the things that I did want to bring up is that I have heard from many community members who are wondering about masking and honestly asking, Dr. Stanley, when will we have an off-ramp for this? When will we know that we will not be wearing masks? And we started the year with the agreement that we wanted to have our 5 through 11-year-olds vaccinated. And one of the reasons why we continue to mask our 9 through 12th graders is because they have siblings. And we found that there was a strong sibling rate. And so we want to make sure that our students are fully vaccinated. We would note that by our next meeting in December, not our November 30th meeting, but by our December meeting, we would know the percentage of students who had come in for their second shot, moving toward full vaccination. I'm looking at you to make sure that I'm saying that accurately. Mm-hmm. Okay. I know that the community is interested in this. I know that certainly the board members have received email about this as well. And I think that it would be important to talk about that. Is that something coming back together on December 13th? I believe that's our December meeting. And having that additional information, knowing that we are at 81% of our students at this point at the high school fully vaccinated. Wondering if that would be something that the board is interested in coming back to talk about on December 13th as well.
Before we move, before we open the discussion up to board member comments, I would just like to put a framework around our discussion and share some comments and perspectives I have. And I've shared this with Dr. Stanley. We've talked a lot in the last 2 days. But I believe as a board and district and community, we need to start migrating our thinking from being the reactive management of COVID as an emergency situation to and thinking about how we keep it out of our schools, to the reality that COVID is endemic to our society, and how do we proactively strategize around living with COVID and best balance the health risks, mental health, and educational best interest of our students on a go-forward basis. I know that sounds like an impossible task, but I think we've really entered a new paradigm with the vaccine availability for children being 5+, even though I want to acknowledge they're not fully vaccinated yet. So that being said, I'd really like for us to start defining a path forward and suggest that we look at doing the following, doing exactly what Dr. Stanley said, coming back at the 12-13 meeting to talk specifically about masking. I would suggest only for the high school at that point, but start reviewing our mitigation measures by age group and solicit some parental feedback about what we're doing and what our parents comfortable with, because a lot of this is about personal comfort level. And I think that's going to be different depending on what your age group is. So my personal suggestion is that bringing back this conversation about high school masking at the 13th, but then we come up for a plan, not only for the review of the mitigation measures, but for how could we solicit some specific parent feedback around some of them to help guide us, and then come back to the community at a later point, which would be after school starts in January, about, this is really what we're thinking about on a go-forward basis, because we realize the paradigm has really shifted. And I'm not saying that means we get rid of them. By any means, I don't want people to take that from this conversation at all. But I do think we need to think about our strategy on a go-forward basis, and how are we proactive about these things, and what do these new things mean now that we have symptomatic testing and asymptomatic testing and all these different layers that we have, and using the best data that we have put together. So I just wanted to share that, what my thinking is, get reaction from board members, and if you have feedback specifically about the idea of the testing or anything else, we can just.
I'd like to also, if we're going to talk about that, make sure that we have a pathway for students to be involved in the conversation. I think especially at the high school, I'd be really uncomfortable with only the adults in the room talking for students. I think students have really strong opinions both ways, and I want to respect those views in making decisions too. So that's the only, I would add that. I mean, I have other comments but in what you just said, I want to really make sure we have a pathway for students to be involved in that conversation and not just make assumptions about what they would all say.
So I think a conversation is a good idea, and a proactive plan. I think we should have a certain amount of base data that we start with. So for example, we typically talk about the rate in the community, the rate in the schools. I would like to have an update on what the risks are, because I think that the medical community kind of keeps varying as we learn more and as variants appear. So to understand what the rates are and what the risks are kind of sets the table for what the next steps might be. And the other thing I want to add is medical capacity. So it isn't just what the risk is for a person getting sick, it's the impact on the medical community and what it would lead to. And of course, that's going to change over time. But just to have a certain level of base data that we know, we all say, okay, here's our base data. Based on this, then we're going to have a discussion about how we're going to proactively address things going forward.
Yeah, and I think that speaks to one of my biggest concerns is we're school board members. We're not doctors. We're not public health officials. And I think we need those voices and that data involved in the discussion. And I think we'd be doing a disservice to our community and our students if we didn't. I think one of the things that I wanted to say tonight was that I hope our community and our students know how proud I feel about the way we have handled COVID and how they have handled COVID mitigation. I took a brief look at neighboring districts. We have so few students in quarantine, and compared to other districts, we have neighboring districts with multiple hundreds of students in quarantine right now. And quarantine is a whole other discussion, but I'm so proud of where students are, following these mitigation efforts, and our staff. It's not to say that any of us want kids to be in masks. I want to make sure that's very clear. It is the worst feeling every morning as a parent to be like, don't forget your mask. None of us want kids in masks, but I'm proud of what has occurred. And I'm grateful that Dr. Stanley, your priority of keeping kids in school without disruption, that we have been steadfast in that. So thank you.
I don't think we can underestimate the strength and the importance of the ventilation, the HEPA filters. There are certain things like, the physical distancing, that gets to be harder and harder. But I think the mask wearing, our rates of vaccination, all of those things are significant. And, the fact that we still have to quarantine, because I know that, the staff is, those calls are very difficult. And, we do talk about that, quite frequently, but that is still, I believe, from a public health standpoint, the right thing to do. And that's what's keeping our students and staff safe and, keeping our numbers at bay. Because it's frightening with these numbers. Oh my gosh, I can't even believe the U.S. were 7-day rate in Minnesota. That's hard to believe. So, I mean, we have to continue to be very diligent about these things that we're doing. And I agree with you. I mean, we always have to relook at what we're doing, but we also have to bring in other people to give us feedback on how do we continue to move forward.
Yep, and I think, to Lenny's point and to what you said, Erica, the question is, we have all of these layers, our ventilation, our HEPA filters, we've got all of that, and to have a conversation about what layers we can peel back, because those are the layers that are going to give the most benefit to students educationally and socially and emotionally. I think we need other voices at the table besides, just our small cluster. It needs to be a community conversation, and it needs to be, public health experts and medical experts, because I would love to be able to peel some of these layers away. And I think our kids deserve it too. Our high schoolers have stepped up at over 80% of vaccination rate. That they've stepped up, and that's pretty amazing.
Yes, I have a few comments. First is I'd like to acknowledge a few things to celebrate. First off is we have maintained full face-to-face all school year, and that is absolutely, utterly tremendous.
For sure.
And so I think all who are associated with that, we can claim that and be very satisfied and happy. The other thing is we've got some very positive things going on. One is we have HEPA filters in every single classroom, and as we learn, they're turned on during the day. They may be cycled down at night, but they're turned on during the day. So we had a comment at the community portion of the community comment portion of the board meeting. They questioned that, but apparently they're on all the time during the day. So community, that's very good news. And HEPA filters are significantly more effective than masks, and you're alluding to that, Mary. So we've got that. Second thing is Jeff is here, has been telling us about the success of our vaccination program of our 1st through 5th graders. Or is it actually
Kindergarten.
5-year-old.
Kindergarten, okay.
5-year-old.
And so we've got 30%. And that's a wonderful thing. So we're talking their first shot and their second shot will come probably in December.
Early December.
Early December. So we're really looking at some good signs. The other thing is we've got a lot of testing, and all of these things boost confidence that COVID is not contained, but it's much more under control. And sure, Minnesota has high numbers, but to some extent that's to be expected because it's seasonal, and across the Northern Hemisphere, COVID's picking up down south. It's not as much because people can be outdoors more. So some of this is to be expected. And given this, I would like to look at two possible options. One of which is, and I think the community really would like to have a discussion about this, and we can get more robustly into this, Erica, on what was the date, the 13th of December. But I would like to propose two things. One is that we make masks optional January 4th and make quarantining of healthy kids. We don't quarantine healthy kids anymore. And we move back toward looking at COVID as an endemic virus. It's much like the flu. And I think that would create more of a natural environment for education, for the kids' interaction. I think the community is very interested in this. Now, and I'd like to have us move from a discussion of illness as opposed to cases. We're talking a lot about cases, but a lot of times when people have COVID, they're not getting sick or not getting very sick. And so just talking about cases, I think, can overstate it. So this brings me to my second point, and I read my context, and I probably have a different frame of reference from my fellow board members. And given that, my second layer of proposal would be sort of piggybacking off of what Lenny talked about. And that would be getting into specific metrics for defining an off-ramp. And so one thing Lenny mentioned was hospitalizations. I have the Johns Hopkins, Minnesota ICU capacity here up on my device. And this is a pretty authoritative source, and I'm just eyeballing it, but the ICU capacity, as they announce it here, looks like there's like a 10%, 15% unused capacity. Now that seems to be at odds with what I was reading in the Star Tribune yesterday, but I would be interested, perhaps a second level would be to track ICU capacity in the hospitals in our region. And if they fall to a certain level, and that in combination with our own rates, if we find that we're successful up to a certain point, that we then move into making masks optional and not quarantining healthy students. And when I say mask optional, I've got to look into the camera and tell the community this. This doesn't mean I'm anti-mask, because people take that. No, if people want to wear masks, that's fine. I'm not calling for a prohibition of masking. I'm just calling it for it to be optional. That's all. So that's interpreted completely differently sometimes. So I would like to throw that out, and perhaps we can have a more robust discussion about this on December 13th. But I wanted to put a little runway here so that we could process that, because I think with more students getting vaccinated, getting their second vaccination, we have the test protocols in place. We got the HEPA filters working. That's 6 weeks from now, January 4th, the beginning of school. I think that's a realistic time frame to look at, and giving parents the choice and the students the choice of whether they want to mask and if they want to self-quarantine themselves. So that's my thoughts.
Hey, Joel.
So I had a question about the asymptomatic testing, particularly what are the next steps? Because I do have doubts about whether we should be doing asymptomatic testing. There is a significant time commitment that you outlined, and so far, there were no positives, but there were not detected COVID in every sample. And then in addition, we did a lot of testing last spring, in which I think the number of positives that were located in the spring testing was very, very low. And so, and the other thing you mentioned was that we don't have in our sample size a sufficient percentage to meet the criteria that CDC recommended to actually get a random sample. And so I'm just not sure from the report where you stand or where we stand on next steps on asymptomatic testing.
So are you referring to surveillance? Or, so for instance, a child is identified as COVID positive and it's you. It's not me, no, it's you. And all of us are seen as close contacts.
Right.
We're asymptomatic. And we've done this within a class now, where rather than moving them into quarantine, we've actually had them test.
That's different than the random sampling of asymptomatic students.
Yeah, so you're talking about the surveillance, just as opposed to, I think, what they were referring to.
Right, so yeah, the surveillance would be that we need to have a larger population of parents expressing interest in being willing to have their children tested on a regular basis.
So where are we at in terms of, are we moving forward with that? Are we not moving forward with that?
So right now, we would not suggest moving forward on that. We did a survey out to our community. The community, 1,500 respondents said yes, they'd be willing to consider having their child tested on a regular basis. And now with the vaccines coming out for 5 to 11-year-olds, that may change significantly, because again, the 5 to 11-year-olds, if once fully vaccinated, would not be required to quarantine, even if they were considered a close contact. So I think as the vaccination rates go up, the likelihood of really wanting to do surveillance testing goes down. The other targeted audience that we've discussed in this group before has been the surveillance testing on non-vaccinated populations. But I think that really falls into an identification of students that are non-vaxxed, and I don't think we want to go there as a school district. So I think that when it comes right down to it, we think that the asymptomatic testing protocol, the way we have it right now, there is value to that in terms of trying to control outbreaks. And so if they're, like we said, if we're doing a classroom size like we did out at Normandale Elementary School, that was an attempt to control the potential for spread within the community, because we know that these latest variations on the COVID virus have just been awful, even with people that are vaccinated. And so,
But if you have a positive in a high school classroom where 80% are vaccinated, then you don't need to do the asymptomatic testing. You're really limited to elementary at the moment, and that will go away as the percentage of.
exactly.
Okay.
And just so people listening need to understand, or I just want to make a point too, we are not testing classrooms or a close contact without parental consent. We are absolutely not doing that. And the same is true for vaccinations as well. I know we had a number of questions about people concerned about vaccinations, and we absolutely did not do that as well. So for any testing, vaccinations, we absolutely get parent consent.
And that's each occasion right now.
Yes.
So we did check with legal on this. So we ask the parents to sign consent for us to test in the AVAX or the asymptomatic testing protocol each time. I will say that there is a lot of interest, I think, in parents in getting testing done, but they want to be in control of when that testing takes place. One little girl that I talked to in line at the vaccination clinic, the parents came up and asked if it was okay for their daughter to come in and get tested, or not get tested, but get vaccinated, because they were talking to the nurse just about how many times this little girl had been tested in the last 24 hours, and she'd taken 4 tests in the last 24 hours, and all of them came back negative. But there was a lot of testing going on, and so families are utilizing the tests that we're sending out to them, and having this additional option. Parents are wanting to have it accessible. I think it's one that I think we do gauge over time, because I think as vaccination rates go up, I think the demand for asymptomatic testing will over time.
Okay, thank you.
Julie, I know you're.
Yeah, no, thank you. Thanks for all this. This was a really good discussion, you guys. I'm really glad as a board. I agree, Erica, with the thought about the mindset of reactive to proactive and what that looks like. I mean, the reality is we're going to have COVID in our schools, period, right? So how do we use all layers of mitigation as effectively as we possibly can for students and for teachers? We know the mask is a barrier, right? It creates, it's tough, and we know that, and I want to acknowledge that. And the students have done a really remarkable job. So I just, thank you, and teachers. So my question is, and my thought is, which I think the board, as we're talking here, is what process can we get to so that when we want to make a move and a change, that we're ready to get there, right? What guidance are we looking at? And so a couple of things that I heard that I agree with and I want to encourage is getting input from students and from parents, kind of a thing like, where's your comfort level now? Also looking at the case rate, and I'm not the expert, none of us are here in this room, but like that case rate seems to be defined differently today than it was a year ago. What does that look like? And what Lenny said about the risk level, that I would be interested in knowing, like what's that risk level look like? So I think those two things are tied together. I really love how the work that you guys have done has evolved with the Q test, and it's not it is not a blind test. It really has a purpose and a value, and I think that brings that value then for quarantine, for all those things, as a really strong layer. Because I think we're going to have testing that is never going away. I really don't think so. So I think that's a great place to really build that strength for our district and for mitigation efforts. The one question I would ask is, with HEPA filters, we know that they're really effective. They're, whatever. Are there any resources that we can put in to increase that? I know kids at the elementary school are coming in for lunch now, right? Is there anything else we can do? Can we ask for some of those funds for testing to be moved into more HEPA filters? Can we do anything like that? I don't know if that's a question I'm putting out there, so that we can have a school that's safe from virus, in spaces that are safe for virus. So I would challenge the district to look at that.
What I can say is we did add 2 additional, and John, I might John, you're closer than I thought. Okay, good. There. We did add to order, I want to make sure that they're added, so that we had 3 HEPA filters in every elementary cafeteria. So we did already expand that. That is interesting idea for classrooms, right? Because HEPA filters are demonstrated as important, to look at that as well as we move forward.
That's great. That's great. So I would push that. And then, it comes down to, I think, masking. And, there's districts that have done, there's a district in Minnesota. I was at AMSD with Dr. Stanley, and we were talking, and they're doing something in their district where it's trial periods, right? So there's an elementary school, if the case rate is low, the masks are coming off. If the case rate is at a certain level, the masks go back on, and it's really managing that. That takes a lot of communication, a lot of community support, parent support, student support, teachers. I mean, it's a lot of layers, but I do like the mindset of that, and that we're kind of being proactive about how we look at this,
There's an ebb and a flow to it.
There's an ebb and a flow, exactly. And then we know, because, if someone tells you to do something for a short period of time, you're like, okay, I'm in, I can do it. I want to make sure that the mask is a mitigation effort that is used wisely, right? So like the tired piece of that, the tired piece of students and teachers and everybody not wanting to put it on, I want to make sure that it's because we need to have it on, so that if it's a high rate, you need to wear it. So I think you guys know what I'm talking about there, but that's just something else that we can talk about. I'd be very interested in talking about that in December, to look at, see where we could go, where this would all look like. So that's kind of my input.
One other quick thing, I just want to acknowledge we've had a couple of community members ask about bringing back parent volunteers.
I'm sorry, couldn't hear you.
We've had a few community members ask about bringing back parent volunteers into the classroom, and so when we're looking at all of these different measures, I think that we should take that into consideration and come up for some guidelines from that process as well. So,
Agree with that as well.
Yeah, that's the guidelines part of it.
Yes.
To me, it's not just a clear yes, no, but how can it happen and what would that look like?
And that's kind of going with all the whole lunch.
Yeah.
Right.
Yeah.
Conversations that you guys that you're having.
I like the way that your approach that you mentioned to talk about kind of the short term versus long term, especially with masks. I think even communicating to students, I don't think they are long term. I don't think as we move from pandemic to endemic that for 100% of people masks become long term. And so I think having that conversation in that mindset is beneficial.
That was a really interesting thing about those conversations. And let's not see it as binary either way.
Right.
So if masks requirements are reduced, it might not be permanent. It might need to go back. And knowing that masks requirements, universal requirements might not be there all the time. That was really fascinating to hear how districts are doing that and how they're piloting that and capturing data to see the impact on their students.
I noticed today, I think it was, that one of our neighboring districts who has really, really high COVID rates right now and with mask optional has asked, not required, but asked that their students mask. So I think that speaks to that when it's needed, stepping up to be a part of controlling the spread.
Yeah. The final thing that I would say is the commissioner did send a letter out, and I think that it's going to be posted. And what I want to say is one of the things that I was the proudest as superintendent in Edina Public Schools is that everything that the commissioner listed, there were 9 mitigation efforts that she listed. And we have every one of those mitigation efforts in place. We have testing. We have contact tracing and quarantine. Kids are staying home when they're sick. Nurses are working with them on that. We have physical distancing. Right now, we are using universal masking. The promotion of vaccinations, the incredible success with the clinic. notification of cases, the hand washing, all of those things that we started out early on with. Ventilation. And again, I appreciate that, Owen, that you shared that piece, that I was able to immediately, after the school board meeting last week, talk with Eric Hamilton to help me understand about the ventilation and about the HEPA filters. And he did explain, and Dr. Smazel went back out to principals, and there is clarity that it's literally about, it's running during the day in classrooms, and then in the evenings they aren't running. However, in our nurse's office, they do run 24 hours a day, 7 days a week. So that was really helpful, and I was able to communicate that out to the community as well. So we do have the ventilation in place as well. And so that's just something that I don't know that all districts could say that they had those pieces in place, and I'm really proud that all departments have come together to really work on it.
Thank you.
Sure. Do you want to read, or should I read Ellen's?
Sure.
Okay, Ellen, this is Ellen, who's absent. I know that if we continue to operate safe and healthy spaces guided by CDC and MDH best practice, we will do what we can to keep our students and staff safe from contracting COVID. Our goal continues to be keeping our students from missing any more school. Secondarily, our objective is to make sure that our days at school are used effectively. On the second point, please give the board an update on the substitute teacher shortage and explain what is happening in classrooms if a teacher is unable to obtain a substitute for their class. Is there anything the board can do to provide any additional resources? She has another question, but that's her first question.
Brenda, do you want to come and talk about conversations we've had about substitutes?
Thanks, you guys.
Thanks, Mary.
Thank you very much. And some processes we have in place. I don't know how much the community is aware of the 7-tier process that we have, but the tiers that we are now implementing at the district level and using licensed staff and things like that.
Sure. So we have multiple levels that we're working through to help support buildings with enough substitutes. So in our conversations with other districts, some other districts are using substitute services. And we've had that in the past, but one of the complaints that we hear often from the other districts is a very low fill rate. So yeah, you might have a substitute service, where you call for a sub with a company, but then if your fill rate is 58, 62, or 68%, that doesn't solve the issue. It's still short. So that's part of the issue. So part of what we started off with this summer and a little bit last spring is trying to think about a different way to handle substitutes. And knowing of the COVID issues and wanting to create consistency of people in the building, starting with some premier subs at each of the sites and having a dedicated number of premier subs for each of the sites. So 3 at the elementaries, 4 at each of the secondaries. And those are people that are there every day, all year long, and they're filling in for teachers that are absent, teachers that are excused for dental appointments or whatever. They're there to fill in all the time. And that's level 1, are those premier subs. And then we proceed down through some other levels. We have 7 different levels in that model. I don't have all the levels sitting in front of me, but I'll try to kind of race through a few of those in terms of details. So one of the things that our principals have done is they've went to each other when those premier reserve subs aren't being used in a particular building. Then they've tapped into each other to see if they could borrow from each other on a particular day. So we're trying to, first of all, really efficiently use those across the district. Secondly, we've looked at other non-load bearing teachers in the buildings that could help sub for either part of the day or for maybe the day. And that might be the media person as an example. And that is a loss of that service. So we do recognize that. But these are other levels that we can kind of go through to make sure that we have coverage for those classrooms. Other levels include other licensed staff that we can help support them in getting the sub-license. or other non-licensed staff rather, that we can help getting them a sub-license, like somebody who has a bachelor's degree and could be a substitute for a day or for an hour or for a couple of hours. We have also, Jody and I have been building a calendar of some district office staff, some of our TOSAs, some district office administrators that could contribute some days and also be available. So the way that works is we build out a calendar of some of our heavy load days. We know Fridays are heavy load days. We know some Mondays are heavy load days because we've collected that data from our principals. We also know that some of the days before or right after a longer break might be heavier load days. And so those are some days that we're trying to front load on this calendar, some of the district staff that could be available to substitute in the building. We've also worked down into asking other teachers if they're able to cover, and in some cases they get time sheeted or get paid for that if it moves their prep then out of the day and they have to do their prep beyond the day. And then Jeff and I have been meeting to talk about the para allocation, and we're short paras. It's very difficult to fill all the para positions across the district. So one of the things that we've talked about is exchanging out some paras for some premier subs under the special ed umbrella that could cover some of the special ed classrooms and special ed supports. So if we can't hire the paras because we don't have the applicants or we don't have the pool, then that's an opportunity to hire another premier reserve teacher that can substitute in those para classrooms. So those are about 5 different examples of the different layers that we're working through to provide, to try to provide sub coverage. And then we've been working, the sub model at the high school has worked a little bit differently because of some of the virtual subs and because of some of the flexibility in the space. And it's challenging. You may have seen an article about Seattle Public Schools had to close, I think it was last Friday, because they didn't have enough staff. We have not had to do that. We don't believe we'll have to do that, but we are trying to navigate it on a daily basis and on a weekly basis.
I am on a 7 district superintendent task force around subs. That is like one of the number one things that comes up at superintendent meetings all the time. And I shared with my team, I shared with Jason that when I talked about this process that we're using, they were excited about it. They want to bring something like that into their districts because right now, the organizations like Teacher on Call, they are stressed. They aren't filling their subs. The organizations who have their own sub pool, what was happening is oftentimes those were moms that were subbing. They had the short call licensure approval, but their children were being quarantined, so they can't use that pool. And so it is a stressor across the entire country and for sure our entire state and for sure the entire metro area. But we are really looking into that. We know that Mondays and Fridays are high and very heavy usage for subs. And so we're trying to look at, what are some options for those? And it's certainly different now that it's pandemic. And that was the case pre-pandemic, right? There was always shortages on Mondays and Fridays as well. First and foremost, we want to make certain that our teachers are able to get to their medical appointments. Our teachers are, that's incredibly important, right? And so to be able to backfill when we can, even with district office staff, to make certain that we are filling those open sub positions, knowing that it's critical. There's a critical shortage everywhere, and we are doing our very best to make certain that they are filled. But our reserve premier sub system is different than most districts are using in their district.
So if the board has questions or concerns about this, I suggest we move it to a different meeting because I think we've moved a little beyond the scope of COVID mitigation measures in this discussion. And so I appreciate the update, but I want to make sure we're staying within the the topic at hand and not violating.
Here's Ellen's last question. Please give the board an update on how the district is using parent volunteers, and I think we answered that. And whether there are opportunities for parents to help the classroom. Are there any vaccination requirements for parent volunteers? So,
Yeah, we don't have any parameters around that right now.
yeah, okay. So I think we've answered the questions.
In conclusion, I feel like I'm writing an essay for my son, which I don't do, by the way. I will follow up with Stacy to put some process around a lot of the things that we talked about. And we do that. I've heard all the feedback and written it down and just put some process and procedure around how we move forward with this. But we will be bringing back some discussion to the next board, not the next board meeting, the December 13th.
Great.
Okay. You look like you have.
Oh, well, I'm just wondering, so we're not having an unusually large number of teachers getting sick now. It's just been kind of, is there any?
So the COVID dashboard, sick for anything? Or are you referring to COVID specifically? Yeah, so in the COVID dashboard, I'm just going to turn over to that. Week of the 12th, there were 8 confirmed cases with staff. And there were there were also 2 staff who were quarantined due to close contact in the school setting, and 2 staff who were quarantined due to close contact in a non-school setting.
Okay. Thank you. So we can move on here.
Okay, thank you. Okay, moving on. Thank you everyone for the conversation. Moving on to Board Legislative Action Committee, with Julie and Owen.
Sure. Okay, so Owen and I are the Legislative Action Committee. I don't know if everyone had a chance to read through this, but just a really brief overview. We kind of looked at, when we had talked about this last year, when we kind of put the LAC on hold with COVID just coming into it this summer, when we talked in August about that, I stepped up to say I would be volunteer to be chair. 2 of the things that I looked at when putting this together and doing a lot of research on how do we kind of reinvent LAC a bit, just to make it efficient and effective and more action oriented. And this goes in line with our school board goals that we put together, and they were approved in September about advocating for policies. And then also in line with our strategic plan, and how do we make sure that the work of the LAC is keeping that at the forefront. So the recommendations are, Owen and I met about this briefly. He was very busy with a bunch of other things going on in his life at the time. But the idea would be that the way that LAC had been set up originally was that community members came together to develop priorities and then brought them to the board. And that was, I think that's a really good process. However, I think it was cumbersome then to get the priorities aligned with our strategy and then have community members have action behind that. And to really start then it was a huge commitment from community members. So how do we look at that? So one of the ideas, and this is, I would love to get board feedback on this, is to adjust that and have the priorities come from the board, an administration, and the Legislative Action Committee members supporting that. So that, because the bulk of the work really had been done kind of, you do semesters, first semester. And then by the time we got to the action piece, it's a lot. It's a huge commitment for community members. So the idea would be then to have the priorities come to the board, have the board approve them so that we know what the parameters are and the guideline parameters, do a lot of work on infrastructure of communications, which what has not been set up yet. So any kind of social media, any our stuff on the website, making sure all our meetings are announced on the website so that they're open to the public. All sorts of things like that. That all takes time and process. So that's kind of the two big things. And then ask community members to be part of this for kind of second semester. So do recruitment in October or November and December, and then have the committee start the work in January from the community. I hope I explained that. That's kind of what the thinking was. And then be able to, the legislative session starts at the end of January. The other thing that I included in here was kind of the partnerships with AMSD and really using the relationships we have with other districts. We know that sometimes we can be more powerful in big numbers. And so being aligned with what priorities are across, they're very similar to what we did last year. If you look at our priorities last year and you look at AMSDs, they're very similar with that. But that would be a really good resource for us to use and to use them as part of our efforts. So, so that is it. I don't know if anyone has any questions. Owen, if you want to add anything else.
Well, and yes, I can add one thing. And a key aspect of the LAC, the Legislative Action Committee, is that we would strike a politically neutral stance. And so there would not be anything that would be conspicuously on the left or the right or Democrat or Republican. It would hew to a consensus line. And so that's a very significant aspect of how the LAC is structured and designed.
100%. That's a great point. And you know, Owen and I had a brief conversation about this, but I think what's important is like looking ahead too, like setting up. Oh my gosh, I just saw that capital spelled wrong on here. My apologies. But I think setting us up so that this might be a year where we're building. I mean, we're already in November, then next year we can kind of take a look again and be like, okay, did this work well? I mean, we're still building this out. I give kudos to the board member Jones and the LAC members of the past 2 years and all the work that they did to get us to this point that we can look at it and say, you know, okay, what do we take what we've done, the really good of it, and move it forward? So, you guys have any questions about it? Or any thoughts?
So I support what you're talking about the school board and administration currently coming up with initial areas to advocate on behalf of. What I'd like to see, though, is an earlier start of the community members of the committee, because what I'd like to be able to do is to have the committee members of the committee be able to give feedback to the board on what we've selected. So there may be, it's sort of like, is there something we forgot that we should have included? Is there something that we have in here that probably isn't going to go anywhere? Just have an extra set of eyes. And if we're going to have community members on the committee, rather than just have them be part of the legislative process, but actually have them give feedback before we approve our final legislative priorities.
That's great. That's a really good addition.
So how large of a committee do you, I was trying to figure out what number you were shooting for with number of community members and number of districts.
The way the original charter was laid out was that it was up to 9 community members. And then, I forgot to add that into, there is a suggestion here of adding up to 2 students.
Yeah.
So they have some student voice in the LAC. And then also adding someone from the administration to help to be a liaison, which was not included before. So yeah, up to 9 community members. Okay. And that's for basically, you know, that's for the work part, getting it together, but any LAC activity is welcome to anyone in our community. And I think that's where we can have be really smart and effective with a push to make sure we're being inclusive of all voices and making sure everybody is kind of tied into what we're working towards and supporting public education here.
So can I ask one more question?
Absolutely.
So I agree with the way this is laid out, but can you just clarify? So I agree with getting a portion of our direction or taking it as like a starting point, the work that AMSD and other districts as a collaboration bring to the table. If that's not to say that, like Lenny was saying, if Edina has a specific issue that we would like to bring forward as being a key priority for us, but this is not stopping that from happening, correct?
No, not at all.
Okay, I just wanted to make sure that was.
No, not at all.
Thank you for doing all this work.
I had two questions. One on the policy on membership and conduct. On B, I was wondering why we were limiting it to people that they must live in the district and why we would not open it up to people that have students open enrolled in the district.
No, that was in the charter originally. I don't know what the thought is, but it seemed important enough to keep it in there. I don't know. I did not look. I would love to. I can follow up with Member Jones and ask her
Because it
where
seemed
that
to,
came from. Unless
I think
board members.
I think part of the reasoning was that they're not taxpayers, and they don't vote. I think that's a lot of it. We haven't discussed it for 2 years.
it might
3
be
years.
something just to think about.
Yeah, I was gonna say, could
Because-
you revisit the conversation?
For a lot of the lobbying issues, they're school-based issues that don't necessarily have anything to do with living in the district, so.
Or they're public school
Yeah,
within the
public-
state of Minnesota
yeah,
issues.
You know, it's interesting. I think it probably bears some discussing because they're stakeholders, certainly, but they're stakeholders at a different level.
So just as something to think about. And then the other thing, I just wanted to consider, wanted to better understand, you talk about, attempts will be made to have membership reflect the demographic profile of the Edina Public School District. I think it might be good to expand on that and not just talk about the demographic profile of the school district, but it would be great if the committee reflected, and I can't think of the best way to say this, but the profile of the district from the different levels of school within the district. If it reflected, made sure that we had a parent that had a child with special education, make sure that we had a parent that had a gifted and talented child, that were really reflecting a spectrum of students that we have in the school district, because that, I think, to get back to Lenny's point about making sure we're not missing anything from a lobbying perspective, not that we want to lobby for special interests, but I think there could be things that's like, well, did you realize this impacts my kid this way? And I want to make sure we don't have like 11 high school parents that might not understand impact for elementary or vice versa. So I think it'd be good to, and maybe we can't, so I don't want it to be defining, like, you
But it
have
has
to
to make a
be.
really good faith effort to do that.
Yeah.
I think that's a great suggestion.
And I love the addition of the students. And I don't know, this just popped into my head as we were talking about in district, out of district, but is it worth putting something in there that our students don't have to live in district? Like if somebody was open enrolled, could they still be a part of this? And I would
Yeah.
think yes, but maybe it's worth putting it since we're putting it all down and now.
While the family member of a student who's open enrolled, when a child open enrolls into our school district, we do receive funding from them. And in a sense, the taxpayer dollars that would be going to their community come to Edina. So they might not have a home in Edina that they're paying taxes on. However, we do receive funding for those students.
Well, yeah, and I think, Erica, to your point about perspectives, I mean, it's a fantastic perspective to get of an open enrolled student and what issues and barriers they could face. So, yeah, I'm going to look into, I will go back and look into that. Those are all really good suggestions. Anyone have anything else?
Alan had a couple of questions. One was, the way it's worded, if we don't have let's just say there are no students interested in doing it, does that mean that we will not have the committee? So it says it will include up to.
You change
I know it says should include to United students, but she just wanted to make sure to clarify that that's not a limitation.
Okay. Okay, well, we can change that.
And then she was just wondering if there's a budgetary, because an administrator will now be working on it, is there any budgetary allocation to this?
We'll see. My team, we work 24 hours a day. So.
Got that, Randy?
I don't get to time card.
He's taking notes on that right now as he works.
Okay. But is there, I mean, I guess that's the question. Are we allocating or are we just?
I wonder, I just presume that she was saying time carding for the budgetary side of it.
I don't know if we have a code for that. That's the question.
I'm asking the question, so I just want to make sure I'm asking the question.
Well, and I think too, we have administrators that do legislative work with what their job already is, and so there's crossover there too. So this is a way to help support that work that's already going on.
And then she was wondering, it says one of the functions of the original LAC was to inform the electorate about electoral candidates' positions on issues important to public schools by submitting a questionnaire to all candidates for elected office. The responses to these questionnaires were printed in the Sun Current and posted on the district website. Why was this function taken out of the bylaws?
I don't remember that being in the original bylaws. It might have been a action item.
So I'll also note, and luckily I'm not going to be in this position ever again, but I think that the number of requests to school board candidates has gotten out of control. I think that there are sufficient avenues within what's out there already for information to be communicated. And so to add another one to that particular group doesn't make sense to me.
So maybe just note that maybe it's part of your brainstorming process, if this is something that.
Yeah,
I think the
that's
next.
more like a strategy,
Right,
which
yeah,
is not
so-
outlined here.
I
Your
don't-
strategies are not on here.
No,
So that
I didn't, I
feels
don't
more like
remember having that on there.
Yeah.
I know that happened. I did see that and I know that happened. It was before I came onto the LAC, but I didn't delete it out of the bylaws unless I'm.
And then she was wondering if LAC members will have an opportunity to sign their names in support of the platform before they commit to being on the committee.
In support of a platform that they had no part in developing. Well, they see the platform before they commit to being on the committee.
Right, but what I suggested was that they have an opportunity to give input to it, so that, to a certain degree answers that question.
Right.
The other thing is, people often sign up for, to assist the district with things, and you may have not agree with absolutely everything that happens. But
Well, I
again,
think
my
that-
suggestion is to incorporate their feedback.
Yeah, I think that's a really good suggestion that kind of addresses that issue then. And I think part of what is important too is that the priorities are aligned with our strategic plan. So that would be an important piece, that somebody coming on to the LAC would be in support of our strategic plan and the strategic direction of the district. And in support of that, believes in the mission and vision, which is actually other districts. Lenny made a really good point about the commitment of school board members and making sure that our committees and all of our work is that we're not drowning in it. And so what I was really trying to do too with this is to make it as efficient as we could be and as impactful as we can be, so that it's so that we're not over committing ourselves to something that we can't do, but making it really impactful. So I think adding the suggestion of the committees is really good. I think looking into living in the district and what that looks like, I think that's a really good suggestion. I think expanding the perspectives, all of that is a really smart way to set us up. Students and open enrolled that you mentioned. And then I'm going to check on the bylaws, make sure I didn't delete something out that was a strategic action that had taken place. But I think that that's an important piece of this too. So I like adding the committee work a little bit earlier is a good change.
Ellen has a couple more observations. The original structure had the LAC functioning to evaluate the legislature's agenda, stay in tune with changes and issues coming up with the legislature, evaluate legislatively controlled issues facing the schools, gather and consider community, staff, and board input, have a discussion to set the legislative priorities that would then be presented to the board for discussion and ultimately for approval. So I think what she's saying there is she'd like to have more explicit integration in with the legislature's current agenda and what's coming before it. So I gather that that's what she's saying here, that she wishes that had more prominence.
I believe it was in there. Did you guys get the impression that this would be, the priorities would be developed outside of that framework?
Okay. As proposed, the legislative priorities will be determined by the committee chair, vice chair, and superintendent's assignee and presented to the board for approval. I don't see where the LAC has any input to the setting of priorities. With the LAC taken out of the process for determining priorities, does the LAC just become the lobbying arm of the board? In such a structure, where is the opportunity for community input?
We've already talked about that.
Yeah. Another effect of this change in structure and function is in diversity and inclusion. While the proposed new structure defines some membership objectives for students and minority members, if those members of the LAC have no voice in determining the legislative priorities, then their presence on the committee seems to be a little more than window dressing.
Well, I think we
Already addressed.
already addressed
Okay.
that.
And their last comment here, the board already has two lobbying arms, both the Association of Metropolitan School Districts, AMSD, and the MSBA, Minnesota School Board Associations. Superintendents have their own lobbying arm with the Minnesota Association of School Administrators. I'd like to see the LAC remain a vehicle to actually gather input and engage with the community, analyze the situation, voice the community and students' priorities and recommendations to the board, rather than eliminating their input in the process. That's
Already addressed.
okay. So that's the host of her observations.
And in no way is this eliminating community input or community involvement. So,
Any other feedback from anyone?
thank you for all the work on this, both of you guys. So I appreciate it. Yep.
No, but I was trying to.
Take care, everyone.
You're welcome.
You're welcome, Erica. Thank you very much.
Okay, moving on to data dashboard. We have now Randy, you get to come up here. Assistant Superintendent Smazel, Jordan Easton Hubert, Natasha Monson-Bailey, and Greg Gosweiler. And we don't want to hear about Aaron Rodgers.
Oh, come on. My warm-up speech.
And there was a COVID update.
I know, it was.
That's
Bring your own chair. BYOC.
Sorry. Cutting it. I'd like to talk to you.
Not the list there, Carrie.
That's what, it's a nasty number.
Yep.
Well, good evening. Thank you for the time this evening. We just want to give you an update on the work around the data metrics visualization or the dashboard and our thinking around that. This is for information for the school board. We're not asking for a decision at this time. And so the what is really about how we take the data from the data metrics presentation that we gave to the board at a recent board meeting, and how we turn that into visualization or information that our staff can act on, or that families can ultimately act on, so that we can make efficient use of the data and really understand where our learners are at and what is needed next for them. So our plan is to really organize that data for staff and for families using a dashboard view. One of the tools that we're going to be talking a little bit about this evening is a tool called Tableau. And we'll ask Greg maybe to show a few slides and to demonstrate what that Tableau system looks like and why we have selected Tableau and what that can do for us. And then maybe Natasha can also speak to a little bit about the timeline for the implementation. So again, the data dashboard is about how we visualize the data that is most valuable and most important to the school district and the success of our students, as determined through the data metrics conversation. And we want to make sure people are able to leverage that. And then we have a new tool that we're going to implement to create those visualizations. Jody, anything else you want to add before we start? Greg, do you want to talk a little bit about the tool itself? Or maybe Natasha, you want to introduce the
I think
tool?
Greg-
And then we can have.
Greg
Sorry. Took the keys out of his hand for a second.
I'm just here to listen.
And then maybe we can close with the timeline and then see what questions people have. Okay?
So did we link the PowerPoint on this?
I think there are slides in the report.
There's slides in the report because of the technical issues. I don't think we can pull it up in here,
Okay,
so I apologize.
There's also a link to this
okay, perfect.
presentation
Yeah.
in.
So we can all see it.
Awesome. Well, then if you
So
want to,
it's on the link is on, yes, page 36. Is that what you're seeing? I am looking at this one.
yep, that's the exact.
It's
Yep.
right there. This-
So it's page
that one.
36 of the report. That was submitted tonight.
So I'll just go ahead and give you kind of a brief overview of what the Tableau software does. And then Tableau in conjunction with another partner as to how we're going to really leverage the power of Infinite Campus, our student information system, as well as Tableau to really create some fantastic data-driven decision-making tools for teachers, administrators, district-level staff, but then also really create some outstanding views for families and our students to really kind of pull data together from many different parts of the Infinite Campus application so that it, really gives them a one-stop shop for the data that they are really interested in. So that's kind of the big picture. Tableau by itself is a data visualization application. So if you're at all familiar with some of the other applications, think like Power BI is another of the big ones. I would say Microsoft's Power BI and Tableau are probably the two biggest data visualization applications in the industry. The reason we picked Tableau is because it interfaces really well with our student information system. We can lean on the student information system to control rights to what our staff, what our teachers, and what our administrators really need to see, right, or what they should be seeing. Whereas other applications, they don't have the level of granularity for user security as this tool set does. So that's a really, really big win for us to make sure that we're not breaking any laws and keeping everybody out of jail. So,
That is a big win. Thank you.
Never heard that before.
So if you just
Back in that column.
Yeah.
That one, okay.
if you just kind of skip to slide 5, we'll come back and talk about kind of the implementation timeline as we'll go through it. But this is just an example of kind of a different view of what we can do utilizing Tableau with the using it within Infinite Campus. Is that this view itself right now would have just the student's picture, a bunch of other stuff that nobody really cares about except me because I like all of that nerdy stuff. And then, you would have to click to 4 or 5 different places within Infinite Campus to get all of this data in one place, right? So the idea of this would be a replacement for the current student information view within Infinite Campus, and so that we can really customize these pieces to, pull data from different areas within the application. As I've kind of transitioned out of my student information systems coordinator role into my data programming analyst role, I've been meeting with building administrators across the district to come up with, what do you want to see, right? And we'll take all of those ideas and bring them together into one thing, because we can't have differences between the buildings we want to set on one, because otherwise it creates a pretty big nightmare for managing things. So this is just a sample of what we can do. Really, whenever I meet with anybody or talk with anybody about data, I always say that we're only limited by our imagination, right? Because whatever we have, we can pull it and display it in a manner for which would be useful and helpful to whoever the user would be. So this is a sample of what it would look like for building staff, parents, and students. We could update the view in Infinite Campus. The next one would be a view of student assessment data. And again, we, in conjunction with Infinite Campus, with Tableau, we will be able to really create a whole picture of our students as far as, so this is an example of assessment data, right? So you can see in there, if you squint, MCA math and math, right? So we can put two assessments side by side. We could create a visualization that would compare all of the assessments or all of the pieces within the comprehensive literacy plan or all of the other elements to see how students at the student level. But then the great thing about these tools is that we can roll it back up, look at the district level, building level, all the way down to the roster level to see how our students are doing on the elements for which we decide, right? In this particular situation, it's MCA math and math. If we then go on, another one of the tools that in partnership with Tableau and the implementation vendor that we're using, they have a set of different dashboards, or what Tableau calls them is they call them VIZIs, right? Visualizations, where the VIZI equals the dashboard. So let's, not get caught up in the vernacular, but they have a whole big set of this notebook of things that we could pick from. And so this is one that I thought, in conversations with, Principal Beaton, that it might be something that we might want to consider at least looking at, right? So this is a college readiness student profile. So it kind of looks through all of the different elements of maybe a student's academic plan, or looks at their transcript, or looks at all of the different elements in the, in the student's, record within Infinite Campus that we can then pull all of that data together. Now, if you look very closely on the right side of this particular visualization and the one before it, you'll see some checkboxes and some drop-down things. All of these visualizations are filterable. So, we present the high-level amount of data, right? We'll show you everything that you want. And then you as a user can then go through and drill down, or only look at the particular data elements for which you would like to see.
And they're also all customizable by us. So this college readiness profile is a template that they've created, but we could decide, well, we don't really need to know this information, or we don't need to visualize that, and we can choose to have some of the stuff turned on or off. So these are just examples of what's possible, essentially.
So then as we continue into, some program information, my day-to-day life right now is, my friends in all of our different programs, ML, Gifted. They're doing a lot of work with, our curriculum for math, and they come to me and they're like, can you tell me how many people are this, that, and the other thing? And Randy, just a little bit ago sent me a request. Can you give me some data on this? And I'm like, ooh. Well, this is an example of like a dashboard that we can pick the data elements that we want to monitor on an ongoing basis and just have it there for, this would be an idea of something that, district level admin staff or building level admin staff would have access to see, oh, okay, at this point in time, we have X number of frame reduced price meal students, or, those really sacred data elements for which we need to hold close. Those are things that we could display here for that level of leadership to see. Going on to the next slide really is about, enrollment in this particularly says math, but, if you put your imagination hat on, really, we can do this with just about any of the subject areas, content areas, whatever it is that we would, want to envision. As Natasha said, these are completely 100% customizable to the needs of what we would have. And then this last, it might be the last. Yeah, it is the last one. I think is actually really, really awesome. It's a scatter plot that really correlates student GPA versus attendance, right? So, it's something that we all think, or we all have a common idea that they're correlated, but this really does a nice job of graphically representing, each one of those dots is a particular student. And so seeing, where those students are as far as GPA is concerned, and then their percentage in attendance. So this is just a sample of the elements that we can put together. And in conversations that I've had with other leaders across the district, we're starting to build that idea of what they're really wanting. And so it's going to be really excited over the next, couple of months to really dive in and start looking at our data and finding solutions to a lot of the challenges that we've had as it relates to data in the district. So with that, I'll hand it over to Natasha if she wants to kind of walk through the timeline or share some additional
Yeah, I'll just
stuff.
talk a little bit about the timeline. So currently we have 4 people in the district who will be trained as creators in Tableau. Greg is one of them, I'm one of them, and then we have another person from enrollment and another person from PMTS. So essentially what that will mean is that we will be able to create any of these visualizations or dashboards that we want. But the nice thing is, to start our implementation, Tableau creates, well, technically 6 visualizations for us. And so we've kind of gathered some data, had some meetings with some administrators around what would we like to see to start. The demographics visualization is just one that they give everybody, so we'll have that one to start. And then we have included some other visualizations that Tableau will actually build for us. So again, they're still customizable, but we at least get to start somewhere and bringing this data to our administrators and letting them see what this looks like and how they might use it. And then the team will continue to work on building out those, particularly Greg and Jen, but we'll work on creating those additional visualizations as Randy sends his request over to Greg. Our implementation process, we will start our training with Tableau. We can start about the week of December 12th. It's a pretty extensive training. They offer some great, there's 4 sessions that we attend just on getting started, but they give us about, I want to say, I'm going to get this wrong, I know, but about 90 hours of implementation. So there's support, there's ongoing training that we will get in getting everything up and running as we want it. The whole implementation process can take about 90 days, and that obviously depends on like our capacity and how quickly we can move through these things. And I think our goal is really during the spring of this year to be able to bring this to administrators and principals and have them start to just really begin those data conversations, start to shift the culture to talk about data. And then by the fall of next year, we'd like to bring this into teachers and staff so that they're in their PLCs having a more granular conversations. They have some student-specific data to work from. And then we'll also roll out that additional feature that some of this stuff will be turned on in the portal. So as a parent, I would be able to see my own student's assessment summary or something like that. So that's a little bit of our timeline. Obviously, like anything, it's kind of, we'll see what happens, but I think we're in a pretty good place. We have some really good people on that team that have already kind of done a lot of initial work to get started. So I think that's all I have. Do you all have any questions?
I've got some.
Go for it.
This is exciting to me because anytime you can systematize this information, Randy knows this. I've wanted to see something like this for a long time. I would be remiss if I didn't point out if it's possible to have, when you're looking at that front page of students, a link to student 504 and IEP information, that very easy to access place for teachers to get that. I would be remiss if I didn't point that out as something, as feedback as a parent.
So that's actually a project that I worked on a year and a half ago, where we, no other district in the state does this, but SPED Forms, our application that manages our IEPs, which is where all of our excellent special ed teachers work with that data. They dump us out a file every night, and we pick that up and actually give the students a skeletal plan, right? I'm not going to go into the details, but let's just say it's magic. In the database, it happens. So that where a teacher used to have to maybe click 5 or 6 times to get to a student's classroom accommodations, now they're linked to the student in the roster within campus instruction. So it's one click, one click, one click, one click, one click. So we, from a student tools perspective, or from a classroom tools perspective, to monitor classroom accommodations, we've come light years in the last 2 years. And so I'll be really excited to see what we can do in the future.
That's great. Is that for 504 as well, or just IEP?
I'm not in, I know it's IEP for sure, because that's what we concentrated on when I built it, but I'm not entirely sure how the 504 accommodations are stored. If they are stored in SPED forms, then they're there as well.
Jeff is shaking his head.
Sure,
Yeah.
either one of the 504.
Any easy access to that 504 for teachers is special. So that makes me very happy. Thank you. My other questions had, and I think I might know the answer, Natasha, with what you were saying, but in my mind, I was visualizing, can parents kind of do a drop and drag and create their own type of report, or could a staff member who says, you know what, here's the 5 things I want to keep an eye on for this particular amount of time, I want to monitor it. Is there a way for them to create that, or do all the pages have to be created by you guys?
So we'll have to do the bulk of the creating, but there will be some of those interactive filtering elements that Greg talked about that they could turn on and off. So if there were a set of things, data elements we wanted to collect for all students, let's just say we threw on 10, but as a teacher, I really only want to monitor these 5. They could check those check boxes, and then the data and the graphs update for them.
So it would be kind of a saved thing where they could go in and monitor that. They would. I'm trying to remember the name of the report that I've used in the past for work, but it's saving it so it's easy to monitor versus rerunning it every time.
I think that functionality probably is there. We're also kind of relying a little bit on our integration with Infinite Campus, and that Infinite Campus is a very heavy cookie user, right? And so I can't say for certain if what data elements would be stored in that cookie. Okay. So we'd have to.
Okay. So not an out of the gate idea, but maybe down the road.
But you'd certainly be able to manipulate your data, and I think that's the biggest thing. I used it when I was in the classroom as a classroom teacher, and just the ability to really drill down to what I needed to see is important. So all of the English teachers got together and we looked at all of English 9, and we were able to manipulate, we just want to look at our summative assessment data and have those conversations in PLCs is super powerful, but we got to kind of control the things that we wanted to look at. So.
And when you think about that data that we talked about in the data metrics plan, really making certain that we had some of that classroom level data in there is really important, because it allows teachers to really manage and really look at their student performance in a different way.
Yeah, and
if we go up to the program level to kind of piggyback on that, we can build a dashboard that tracks our progress around the literacy milestones as it relates to the comprehensive literacy plan. We can track our data around social emotional learning progress as it's fed by the panorama surveys. We can track our data around exit surveys that information is collected, and we can build the dashboard that has the exit survey. Longitudinal data, having multiple years of data eventually built in this, so we can do longitudinal analysis, non-resident data. early learning center data, we've been trying to figure out how to get those teaching strategy goal assessment results into a dashboard. So we need to work with them to figure that out. But I think there's a lot of opportunity to go from classroom all the way up to program level or all the way back down.
What Tableau allows us that our other system didn't is for us to make a decision and do some programming around that, so that we can have that data at our fingertips in order to make a difference on student performance, regardless of the percentile that you're performing.
Okay. Yeah, that was my last question was going to be around, are there any gaps that you see this not filling in what we have historically felt as like a hole in our ability to gather information and to utilize information? Do you feel like this fills all those gaps? Is there any piece of information that can't be used as a data source?
I think our biggest thing is going to be to figure that out, because we do collect data from multiple sources right now. So Greg's done a lot of work to build tables in Campus so that we can pull this data. But we can also, with Tableau, put in CSV files or other, so there's a lot of different data sources we can use. We can even connect it to financial information and such. So we will have to figure out what those connections look like. I don't see something we couldn't put in there, but some of it might have to be creative and we might have to get imaginative, might require Greg to build some things to make it happen. But that's kind of what we expect it to look like, so.
One thing that comes to mind is, we're adding the SLEDS data, so the persistence in college completion data. We don't really know if MDE has a way that they could provide a CSV file so that we could load that in there. That would be fantastic if they did. But there are some things like that I'm not certain about.
Thank you for taking this on. It's very exciting.
I'm absolutely thrilled at this. This is just going to provide more clarity, more visibility into the phenomenon of the district, and we're putting our toes in student data, but we could do it with finance, we could do it with SLEDS. There's so many applications that Tableau has. So, Stacy, thank you for sponsoring this, supporting them in this. So I'm just absolutely thrilled that we're moving in this direction. Yeah, Tableau is really one of the big names in data visualization. And so just for clarification, we chose Tableau as opposed to Power BI because it integrates better into Schoology. Is that a primary driver?
Infinite Campus, our student information.
Infinite Campus, rather. So it integrates in better, whereas Power BI didn't.
Well, so Power BI has some challenges as it relates to user security, where, we want to make sure that our teachers have access to the students that they need and, and our staff to the students that they need, where Power BI doesn't have a mechanism or a tool for us to really lean on our Infinite Campus user security, where if we were to look to Power BI, it would be at a very, very, very high level, right? Which is how we're using it currently, is we visualize big groups of data so that we don't have any identifiable elements. And as you drill down to that roster level, those teachers have a need to see that individualized data, but we can't control that in the Power BI world, where we need to, we could, but we would be duplicating our user security efforts in two different arenas and would be very unmanageable as a way to manage user security.
I'm just piggybacking on that. DMTS in the past couple of years, so before my time, I don't take credit for this, did an immense amount of work on user security and where people get permissions for different things. And so being able to find a system that couples with that, just like it saves us so much headache in the long run, but also being able to get access to the data that we really want.
So it dovetails pretty well with our existing on the ground.
Correct.
Very well.
Yep.
I think it's exciting how you've come up with some creative uses of it, like this composition report, student demographics. That's just telling on how many different ways this could be used. I'm like this scatter plot. Then something I've been lobbying for a long time is we've got this map district analysis. This is not in the slides, but this was in our, in the packet. There's two reports here that the community can see if you go to the board packet. And I love how we're breaking down the RIT scores by grade, and we've got the targets, and I think that's thrilling. Now,
But these aren't real numbers, though.
No, this is not our
That's what I
data.
make sure
This is not
Yeah, I
our
was gonna
data.
say, I
Oh,
don't-
so is this?
No.
This is not our
I
data.
just didn't want the
But
public
this
to
is
be
a
like,
sample. But
Yeah.
Sample.
Yeah.
And
Okay.
it may or may not
And so,
plan exactly that way at the end.
so my,
Correct.
okay,
Through this process.
still my larger point though is, so we have the capacity to do this.
Correct.
And do we have plans to put this, now, right here, I'm reading that within Infinite Campus staff tool, can this be made available, this specific report, to the board and then to the public? Because it doesn't get into identifiable student data, but it is. And so what would need to happen technically in order to get this up on the district's website?
So we provide updates all the time, for data. And I think that what Tableau did for me as a leader in the district that I came from is allowed me to provide detailed data to the community that they weren't getting before. I was not limited anymore. And so a report like that could be included as part of the World's Best Workforce Plan or something like that. And then the World's Best Workforce Plan would be posted on the district website. So it's not as if community members would be able to go in and get that themselves, but we could definitely post that information so they'd have access to that.
Yes, I think that would be thrilling. Got map mean score analysis with the spring hunt, of course, that's an example. So
Yep.
I think that's just thrilling. And then this is such a powerful tool, and it's increasingly being used, and also Power BI. Is there a way that there might be some DECA class that could have access to Tableau to learn how to use this? Do we have licensing so we can actually use this in our curriculum in some specific classes? Because there are kids who could become specialized in this, and right after graduation from EHS, get a job in this.
Fascinating idea.
Yeah, that's a great idea, and there are ways to get people kind of limited access where they wouldn't have maybe all of our data, but they might be able to put their own CSV file from a DECA presentation, and there are ways that we could use it differently.
Oh, there are all sorts of data sets. I mean, you can draw, the federal government has all sorts of speed violations, speed rates, gas consumption, you name it. That could be a part of what we could offer in the curriculum too.
Well, there is, so when you think of where we are, where the district is at, is we have 4 of the creator licenses, but there is a public version of Tableau that we could use for educational purposes to teach what you're trying to do. So it's very there's a realistic possibility.
Wouldn't it be cool as one of our pathways that we have a certification process for data visualization for our high school students? Something that they could accomplish by the time they leave Edina, and a credential they could take with them.
Industry standards.
Yep.
Right? Tableau's industry
They can go right out of the chute if you get a job.
Yeah, absolutely.
What I'm thrilled about too is I've actually gone to Sleds and I've downloaded all the current data, and I've used Power BI to churn through it. And, I've got, this is my side hustle, I've got a regular job, so I can't throw a ton of time at it, but what I think is, with the professional team, Natasha, Liddy, and Greg, what you're doing, you all have the capacity to really dive into that Sleds data, and there's all sorts of it. And I haven't even touched the post-collegiate analysis, that longitudinal data. So it's just thrilling that we have access to it. And the thing about Power BI and Tableau is that it's so quick with how you can gather the data and how you can twist it and bring in other elements, put in side data series to reinterpret the data. So it's very exciting.
We are really excited for how it's going to allow us to use the various metrics in our data metrics plan in a different way so that we can look at our system and the success of our system in an additional enhanced way.
So kudos to you all.
And can I just confirm to just our community here, the gratefulness that we have, that this is possible because of the voter pass tech levy, am I correct? This is an amazing, just another opportunity to say we're grateful to the community that that's where the funding for this endeavor would be coming from. So thank you. Thank you to the community.
So Lenny, you're taking over now. Apparently, any other questions?
I do. I have one.
All right, Julie.
Well, actually, it's not even a question, it's just a comment, but it's like, this guy is not in the weeds. I love the data people sitting next to me and I like numbers, but when I look at this, this is fantastic. I imagine it to be an excellent tool for teachers and even showing at open houses, parents, like what they can see, all of those good things, right? I think about if I'm sitting here and I'm a student, I just want to make sure we're being really intentional of the data that we're showing kids, right? So they don't click on here and be like, oh my gosh, my MCA is here and my MAP score is here, and not really understanding how all that works together. But maybe it's a whole student approach to the data that we pull. I know on Infinite Campus, you can pull up even your transcript, right? Like it's all connected. If you were on a sports team, if you were in Zephyrus, if you were all of those different things, if you were an intern at GMTS and getting your license certification here, right? But maybe that's something else we pull so that it's just the students can see the whole picture, not just on the numbers. I just worry about that from a mental health standpoint. So
I think that's why we're mindful too about the rollout, that's not, the initial part of the plan is not for students to have that, so that we can make those decisions and see what needs to be there and what data should students see and what capacity they have to understand that data as well. So
great. Yeah, I thought the timeline was really made a ton of sense. And it's obviously an incredible useful tool for assessment for our staff. So excellent.
That's a good point, Julie, to make sure that we're intentional, that it's a reflection of them as a whole child, right? In the development of it, that's a really good point, so that they can see themselves as more. So thank you for.
Yeah, and I think even at Infinite Campus right now, you can opt out of like seeing some of the test scores or some of the even getting notification on homework for the parents. Like there's all sorts of stuff because I've done that with my kiddos. So.
You can have to see it all like I do.
Well, right. I'm like, your homework, you see it. I don't want that notification. That's how it goes down with the greenhouse. That's okay. Anyway, really good, really exciting stuff. Thank you for the presentation.
All right, thank you very much.
Thank you.
Thank you.
That sounds like a lot of work.
All right, we have an action item. So can I get a motion to approve the masking update proposal?
So moved.
Second.
All right. And Randy and Troy?
Troy's not here. No other updates around it. We did bring it to the board for consideration at a previous board meeting, and we don't have any changes or updates to what we had presented to the board previously.
Any questions? All right. All those in favor of approving the masking update proposal, say aye.
Aye.
Aye. Any opposed? Motion passed. Next is board chair updates. This is great. Here's my chance. I've been waiting all year for this.
And it's like, let me get my list out, guys.
I do not have any board chair. Sadly, I wasn't given enough advance notice. Superintendent updates?
We talked about one of the highlights, and that was the vaccination clinics. And so just really, just delighted for that and all the work that Jeff and his team has put together to make that happen. The other thing that I will take this time to do is I have heard from several via email, via phone conversation, from several community members about policy 206 and concerns around where we're at with policy 206, what might happen with policy 206. And so, first of all, I want to say that I've had a staffing change on my team. And so we have not been able to meet for policy committee for a while. We're going to have our first meeting on Thursday. And then the other thing that I would like to say is I have had a chance to speak with Chair Allenberg, and the board asked for that policy to go back to the policy committee. And I believe, based on where we're at, the concerns that are there with stakeholders and the public, it is not time for us to look at making any updates to that policy. Now, that is certainly, my recommendation. That doesn't mean that we have to go in that direction. More than anything, I want the community to know that we are not planning, working on a policy behind the scenes or anything like that. It just really is delayed right now due to staffing changes. And we want to garner community voice. That is something that is important to all of us. And so I just want to give a status update on that, because I have received many email and phone calls about that in the past few weeks.
I could just piggyback on that. I think it's very good, Stacy, that you just made that announcement to the entire community, because there is a lot of concern about that.
Yes, sir.
And I think a lot of people would like a lot of the community would like to have the opportunity to communicate their sentiments and feelings and opinions to the board. So that is a reassuring statement. Thank you.
Absolutely.
All right, we've completed the agenda. Are there any objections to adjourning? Hearing none, we are adjourned.
I didn't want to dive into too much of depth
Oh.